Hey guys, what's up? It's Kiki, just here with another YouTube video for you guys. This one is going to be a little bit raw, kind of personal. I didn't really want to edit this one too much, only because this is really important to me. Um, this is about a realization that I had that self-care is extremely important. Um, and I'm almost coming up on a year now that I had a major surgery done. Um, well, I guess I should probably start from the beginning. Um, I used to be really adamant about going to the gym, sometimes 4 hours a day, 7 days a week. With the job that I had at the time, I ended up getting promoted, so I lost a lot of gym time, but I was still really aware of my body. I was like, what's this ache? What's this pain? But the job that I had did not have health insurance. Um, about a year into my promotion, I was really going hard, 100 hours, just constantly working. So, of course, that didn't leave much time for me to go to the gym. Of course, I started to gain weight. I didn't really think anything of it because my job was more important. The people that I was managing was more important. Um, After a while, I started noticing, of course, that I was a little heavier around the midsection. It happens. I wasn't really stressed about it. My mom, who's a nurse, became concerned because I was visiting them one day and I fell asleep on the floor, and she noticed that part of my stomach didn't really move with the rest of my body, with the position that I was laying. She kept asking me about it, telling me to go to the doctor. I was like, it's fine, don't worry about it. I'm just a little bit heavier than normal. I ended up getting a new job, which allowed me more time to go back to the gym. So of course, that's the first thing I started doing. I did slim down some, but I noticed that one part of my stomach still stuck out. I chalked it up to maybe I was working out and not sucking in my stomach, so that way my muscles were tightening. Maybe I had gotten a hernia. I wasn't having any pain, no symptoms. Everything was fine. I ended up getting a second job because I don't like to sit still. So the other job was more manual physical labor, and that really kind of started sliding the weight off of me. When it started to happen, I noticed more and more people were asking me if I was pregnant. I was like, no, I'm not pregnant. Like, I don't know what's wrong with my stomach. That's just what it looks like. Like, I had just kind of grown to accept it. Um, and then one day, my parents were both kind of like, something's clearly wrong. We don't know what it is, but like you should definitely get it checked because it's not normal. Like, it's not normal. I still brushed it off. I'll be the first to admit I don't like needles. I don't like doctors. I have really bad white coat syndrome, but I felt I knew my body. I work out. Like, I know when something's wrong. I know when something feels wrong. So I didn't think anything of it. I was laying in bed one day and I was reading, and I had my book like propped up on my stomach. I went to go put the book down, and you kind of just look downward, and I noticed that my stomach was at an angle like this. And I was like, that's different. It's not, like completely flat, but it's not round like I'm kind of pudgy. So I started to push on it a little, and I was able to kind of like move it around. And I was like, okay, maybe, maybe they're right. Maybe something is wrong. Um, I tried to get an appointment with my primary care physician, which was a nightmare all in itself. With my new job, I had health insurance, so I was like, let's just do this. But my provider was not accepting new patients, even though I was assigned to her. So thought next step, go to urgent care. Um, I figured it would just be a quick in and out appointment. I go in, my dad goes with me, of course, and um, I get in there with the doctor and he's like, all right, so, what are we here for today? And I was like, my stomach. I was like, I'm not feeling any pain. I don't know what's wrong, but, it's causing alarm. He asked me the normal questions, like, how's your periods? Are you experiencing any pain? Like, when did you notice this? And, I told him, just noticed it, maybe about, it's probably maybe like 6 to 8 months then that it was really noticeable. And so he goes, okay, lay back on the table for me so I can look. And when I leaned back and the way my stomach propped up, the doctor goes, oh. And he's like, are you sure you're not pregnant? And I was like, I'm not pregnant. And he's like, you're positive. And I was like, I'm 100%, like 2000% sure I am not pregnant. And so he's feeling on my stomach and he's like, I want to have you take a pregnancy test, just in case. And I was like, unless pregnancy is like now 3 years, then, I don't know what to tell you, but fine, whatever. So take the pregnancy test, comes back negative. He's like, well, what I would like to do is schedule you for an x-ray. He's like, it doesn't feel like anything's solid, but let's start at the bottom rung and then work our way up. Had an x-ray. X-ray came back negative. Next was the ultrasound. I went to have that about maybe 2 weeks later. And as I'm laying on the table now, I'm starting to get a little bit more nervous because I can see the screen and I'm not a medical expert, but at this point, I've been at home Googling things. I'm looking up stuff. I'm asking my mom because she's a nurse, and I'm looking at the screen and I'm seeing this mass that looks really big. And, there's some other stuff on the screen. I'm guessing they're organs, but I'm like, I'm not an ultrasound tech. So, just kind of relax, just see what they're doing. My ultrasound was almost 2 hours long because the tech could not figure out what he was looking at or what was going on. He still, of course, had to give it to the person that read it, but he was like, I want to make sure, I scan everything because I'm not sure what's going on. And I was like, no, that's fine. So that made me a little bit nervous, but hey, still, fingers crossed, trying to stay positive here. I ended up getting a call back and from the doctor who scheduled my x-ray and my ultrasound from urgent care. And he proceeds to tell me that there is a 14-inch mass in my abdomen. He's not sure what it is, or where it's coming from, but he wants to refer me to an oncologist. By then, like, my heart is racing. I'm like, oh my gosh, like, what is happening? What do you mean? So it takes about another 2 to 3 weeks for me to see this oncologist. And both my parents go with me to the appointment. He's, checking out my stomach. He's like, this is what we're going to do. He's like, I want another ultrasound. He's like, I want an MRI. I want, everything scheduled. Let's do the full thing. Let's do the blood work and everything else. He's like, I want to see what's going on. I even had a CT scheduled. And when it all came back and we met up again, he looks me right in my face and goes, I don't know what's inside of you, but it's big. And the fact that this man who was a professional, who is, we Googled him to, check and see, what other patients had said about them. This man is almost at the top of his field, nothing but 5 stars across the board. Everyone loves him. He's amazing. The fact that this man looked me in the face and told me he did not know what was inside my body, it was like a gut punch, like just straight to the stomach. And I just sat there just frozen. And I remember like trying not to have any emotion for my parents because I didn't want them to freak out. They were already on edge. And so I was just like, okay, what do we do next? And he was like, this test, that test, this test, that test. And after a while, it just kind of turned into, I don't know if you've ever seen the Charlie Brown movie when the teacher talks, it was like, wah, 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 wah. And I remember at that point, like I kind of just shut down and went like numb. It was all in one ear and out the other. Honestly, I don't even know how I got referred to the surgeon that I ended up having, but I ended up going to another doctor who was a gynecological oncologist, because the mass was so big that it was like kind of under my rib cage, but in my kind of like down to my pelvis area. So they wanted to bring him in on the case to see if he knew what it could be. Same thing with him. Less blood work, thank God, because I don't like needles. So already I liked him in my book. Um, when we came back and we met with him after we got all the test results, he asked me, how long has this been here? And I go, I don't know. I was like, I really just noticed it. This was now maybe like 9 or 10 months in. And I was like, I just started to notice. He's like, does it bother you? Like, do you have any issues? And I'm like I tell everybody else, no. He sits down and he's like, so when we went through your MRI and your ultrasound and your CT, he's like, I looked through the ones that you did with the previous doctors. He's like, I looked through the ones that you had with me. He tells me, he goes, I can't see any of your organs. And I go, what do you mean? And he pulls up the screen for me of, because I had his CT biopsy because they wanted to take a sample of what I started calling my little monster. Inside of me, they wanted a sample of my monster. So he goes, he's like, it's a fibroid, what did he call it? A complex fibroid tumor. Part of it was fibroid, the other half of it was liquid filled, but they didn't know what it was filled with. He told me that he thought maybe it was filled with blood because my iron count was extremely low. He was like, I don't know how you're working 2 jobs. He's like, with the hours that you work, he's like, and still managing to have the energy that you have. He's like, because most people, he's like, by now we would have been like, you need a blood transfusion. But he goes, we need to actually get in there to figure out what it is and get this thing out. He's like, right now your blood count doesn't show anything with cancer. He's like, but I want to be 100% sure. So I'm like, fine, let's do it. And he goes, but there's one thing. And I'm like, okay, what's this one thing? And he tells me that with this surgery, it's still hard to say that you may end up not being able to have children afterward. And he was like, do you have any kids? And I was like, no, I don't have any kids. And he's like, this is pretty serious. He's like, so what I'll do, he's like, I'll send you to a fertility specialist. He was like, see if maybe she can get any insight before we do any surgeries to see, what your options are and, what we can do. Fine, like let's go ahead and do it. I had been talking to the guy I was dating at the time. We've known each other for years about having a kid, so that was kind of hard for me to take. My both my parents took that pretty hard, so I didn't want to, freak them out with how I was. But when I came home, like I remember just crying constantly for hours. Like I had busted blood vessels all underneath my eyes. I looked insane. But I was like, let's do this. Let's see. Like, nothing is certain until they get in there. I go to fertility specialist, and she sits down with me. She's telling me, what my options are. She tells me, if I do end up having to have the hysterectomy because of this little monster, that, I can always get, surrogate, I can adopt. We all know Kim K, so, I know my options already. I'm like, yeah, and she goes, she was like, I would like to see though, she was like, if it would even be possible to harvest, your eggs if we needed to before the surgery. And I was like, okay. So she goes in, and just a side note, I'll let you guys know, I've never had so many things stuck up in my body before. Like, at this point, I was like, I might as well take a picture of it and put it on display. I feel like everybody in this medical department has seen down there. But we go into her exam office, and she's looking all around. And she goes, she's like, I can't even find your uterus. She's like, I don't know where it is. And by then my attitude toward everything wasn't like I didn't care, but it was just kind of like really at the dark end. Like, I was just kind of like, this is all going to be bad. So I was like, well, then stop cranking that thing like a Ford, and take it out. So, that way we can get on with the rest of this. I go back to my surgeon, who was Dr. Nguyen. By the way, Dr. Nguyen, you are the best. I love you. Thank you so much. And he's, talking more tests and everything else. And I told him, I was like, let's just get this over with. And he's like, really? And I was like, I was like, you said you need to get in there to figure out what it is and get it out. Let's do it. Because in the span of time from the time I went to the urgent care until that day, my mass had grown. I want to say they said about 5 or 6 centimeters. So clearly this thing is alive and doing whatever it feels like it wants to. So, let's do it. Let's get it out the way. My parents were like, are you sure you want to do this? And with what I've been through in the past, just with my family members, like my grandparents, I took care of them. I've always been a quality over quantity. So I sat down with my parents. I told them, I was like, even the guy that I was dating that we were thinking about having kids, I was like, look, at this point, I need to know if I have cancer or not. I can't be someone's mom if I'm dead, if this is cancer and this is something bad. Like, I can't be someone's mom with that. But I can be someone's mom if we can get this out, if we can see if I can even have kids, and if I can't, like, I can still adopt, like, they're still foster. I have options, but I want this out. So they were like, okay, let's do it. I go to my surgery, and Dr. Nguyen is there. He's awesome. He's like, are you ready to go? You set for all this? And I told him, I was like, I have one request. Well, I had 2. But I was like, and he was like, what is it? Anything, tell me. And I was like, if you can, because at the paperwork that I signed for my surgery said that this was like full hysterectomy, ovaries, fallopian tubes, uterus, all of it. I was like, if you can, like, if it's not on my uterus, can you do whatever it is you have to do to save my uterus or at least my ovaries? Because I don't want to go into menopause. I'm only 36. Like, I can't go into menopause. He goes, deal. He's like, that's fine. He sends the nurse out to change the paperwork so I can re-sign it. And he's like, what's request number 2? I was like, I want to see it. And he goes, you want to see what? And I was like, I want to see this monster that has been living inside me. And he goes, I can't wake you up in the middle of surgery. I was like, please don't. Take a picture of it. If you got to bring it in the room afterwards. I was like, but I want to see it. And he goes, all right, we'll figure out, what we can do. So I wasn't scared about the surgery. It was weird because I knew my parents were worried. My brother was worried. I'd called him that morning, let him know, what was going on. And I was getting ready to go to this. So I was like, I'll call you when I come out once I wake up. But I wasn't scared of the surgery at all. Like at that point, I wanted to get it done and over with. Like I wanted this new start. I wanted to see, what was going on. Um, I remember like they, wheeled me down the hall because they didn't put me under until I got in the room, and I told everyone good night. I was like, night, guys. I was all good luck. And I remember going to sleep. And the next thing I remember is waking up and I'm in the recovery room and I look at the nurse who's sitting right next to my bed and she's like, hi. And I go, did we get it? And she goes, we got it. And I go, cool. And conked back out. The next thing I remember after that is they're wheeling me into my actual room and my dad being like super close in my face, like, do you know what time it is? Apparently I'm cranky when I'm still medicated. And he said that I told him no because I've been busy having surgery and there's no windows in here to get out of my face. But and Dad, I'm sorry. I was sleepy and medicated. It wasn't my fault. It was the drugs. But my surgery was only supposed to be 3 hours. It ended up being 8. And I was like, what do you mean my surgery was 8 hours? So I was in and out, so the doctor didn't come in and like tell me what was going on that day. Dr. Nguyen comes in the next day, and first thing out of my mouth is, why was my surgery 8 hours? Like, what happened? What went wrong? Like, did I die on the table? Like, what? He goes, your mass, he's like, is the third most complicated surgery he's like I've had in my entire career. And I was like, oh, top 3. He tells me that when they opened me up, the mass was like 14 inches long. It was 22 pounds. My uterus was in my rib cage. He was like, it was nowhere near where it was supposed to be. He was like, all your organs were nowhere where they were really supposed to be. He was like, everything was mashed down by the weight of this thing. And then he kind of like pauses for a moment and looks at my mom, and my mom's kind of real quiet and teary-eyed, and I'm like, what? Like, what is it? He goes, he's like, it was, sorry. Like I said, no edits. We're doing this. He goes, it was, your mass was crushing, well, it was pushing against your heart. He was like, if you would have waited another 2 months, we might not have been having this conversation. And like, that's when it kind of hit me, like the extent of, what this was. And I was like, okay. He goes, it was, he's like, it was also making your kidneys back up. He goes, you weren't close to kidney failure. He's like, but you were on your way there. And he shows me the monster that he took out of me. And he took 2 pictures because Dr. Nguyen is thorough. And the first picture he shows me is while it's still inside of me. And when I tell you guys that this thing was a monster, I'm not exaggerating. It had its own blood supply, which was why my iron was so low. You could see, I don't know if you've ever seen those bodybuilders that are super buff and they have these huge, massive veins like running through them. That's what this thing had. It had these huge veins running through it, and it was literally sucking me dry. it looked like something, it's like some pink out of a scary movie. I can't even begin to explain it, but it was, if he would have told me, I never would have believed it unless I saw it. And then he showed me a picture of when he took it out, and he's like, I wanted to get it all in one scoop. He's like, I wanted to make sure that, you know, everything was out. He's like, which is also part of why your surgery took so long. And he shows me the picture of him holding it, and it looks like he's holding a kid. Like, it's, if you can imagine, you know, what 14 inches is and 22 pounds, he's, of course, you know, holding it down like this because it's weighty. But I was shocked. And I can't thank him enough for saving my life from that monster. But he told me that there was no cancer. He's like, I checked, you know, lymph nodes. He was like, while you were still open on the table, he's like, I made them go and run that. He's like, because I wanted to make sure, you know, that you were okay. But I came back cancer free. I got to keep my ovaries. I did end up losing my uterus, but he was like, you know, you won't go into menopause. And I was like, awesome. He said that judging by the size of it and how comfy that thing was in there, he said that that thing was probably growing in me for the past 2 years, and I didn't know it until, you know, I was slimming back down. I was in the hospital for 5 days. I ended up having a scar that is from the base of my ribs down to, I'm not good with my anatomy anymore, my pelvic bone maybe? It's almost in my like bikini area, so that we are all clear of the picture. And I had a little drain that was put in on my right side. That was gross because I had to like squeeze it to get the suction going, and it was just it was sucking gunk out. I had that for about a month, and then I had because while they were trying to take out this monster, they had to call in a urologist because my monster was also stuck to part of my ureter, which goes from your kidneys to your bladder. They had to cut that to get it off, and I had to have a stent put in, so I still had that going on. They wanted to make sure that there was no scar tissue forming and that I peed normally. I had a catheter for about 2 days while I was in the hospital. They took that out, and I was able to pee on my own, which was so far a good sign. When I got released from the hospital, I stayed with my parents for a bit because, you know, mom's, she wants to keep an eye on me. I did pretty good, healing wise. I wasn't really in a lot of pain, on occasion, and it still happens now. If I do too much, my body definitely lets me know. I'll get what is called swelly belly, where I kind of get puffy at where the mass used to be at. But I thought that I was, you know, for the most part, like, this is it. Like, I'm over it. I'm done. I came out with a really positive outlook. I was like, you know, I feel like I got a second chance at life. Like, I literally had more energy the very next day. Like, I was up and shuffling around the hospital. I was like, I want to go do stuff. And everybody was like, you got to sit down. Like, you just had serious abdominal surgery. Like, you got to chill. And I was like, doctor said I could walk. And they were like, yeah, but limits. But it's, I'm still healing physically. They said it takes about a year. Mentally, though, I feel like I really have a long way to go. I have my moments, not as much anymore. But I remember there was a day I was at home because I was off from work for, I want to say 4 or 5 months, maybe. June. My surgery was end of June. I went back to work November. So whatever span that is between there. I was watching Keeping Up with the Kardashians. It's a guilty pleasure. Leave me alone. And it was True's birthday. And you know those people throw massive, amazing parties. And I was like, I want to see it. Like, I want to see it. And I was watching it and I was like, this is so cute. Like, there's pastels and unicorns and stuff everywhere. And I was like, I kind of want to party like this myself. But watching Chloe walk around with True, it kind of hit me then that I would never have kids of my own, because, you know, I can't carry. I have my ovaries, but at the same time, my insurance does not cover for me to have, you know, surrogates or anything like that. And I found out while I was at the fertility specialist that medication alone is $500 to $800. And I was like, ooh, it's almost like my whole paycheck. But it hit me, and it hit me harder than I thought it would. And I just doubled over and just started crying. Like, it was gut wrenching thinking about it. And I Snapchatted my friend about it when, you know, like while it was happening, because I really couldn't see well enough to text her. And when I look back on the video, because I kept it, I was like, wow, like this is real, like this is intense. Even now, like, it's still hard for me to, you know, go to kids' birthday parties. I have yet to bring myself to go to any baby showers, but it's just the sadness of not being able to be like, you know, oh, look at my tummy. But at the same time, I don't think, with so many people, when I was like, still had the mass of me, people were coming up to me and touching my stomach, and it drove me insane. I hated it. And I don't know if it was because I wasn't really pregnant and people just thought I was fat or what, but at the same time, you know, I kind of think of it on the lighter side, like, you know, maybe this is okay because you don't like really being touched like that. And, you know, pregnant people are not supposed to swing at other people. You ladies are totally allowed to, because I want to tell you guys, for people touching your stomach constantly, not even asking, strangers you don't know, it's not okay. But there's a ton of kids out there that don't have families, that need love. And I was like, I'm okay with that. Like, I'm perfectly fine with adopting, you know, a kid. Hell, give me two. Like, you got a little brother, little sister, everybody come on, let's go. It's about to be a party at Kiki's house. Like, let's do this. And that's kind of like my outlook on it now. That's what kind of gets me through my little dark patches, is that there is a little boy or a little girl out there who is waiting for me, who is going to be given so much unconditional love, and is going to have the happiest life that I can make sure that they ever have until the end of time. Like, that's what makes my day. That's what, I mean, you see the smile here. This is what I absolutely love. Like, I want that. As you guys go through my videos and stuff, you'll hear me talking about, you know, like my brothers and my sisters and stuff. I'm technically an only child, but I refer to a lot of people close to me as my brothers and sisters because my parents were always like that. They were like, you know, oh, you know, this friend of yours, they're super close. They're so close that they have gotten comfortable enough with calling my parents mom and dad. And so I think that's what helped mold me to be, you know, okay with this. But what this video, the reason that I posted this video is because I want you guys to know there is nothing, and I feel like I'm going to cry. There is nothing, no job more important than you. Doesn't matter how much they are paying you. There's nothing that is more important than your life. If I could do it all over again, knowing what my parents went through, knowing what my friends and family were terrified of me about, I would have never waited that long. And it was all because I wanted to make sure that, you know, I was able to keep my job and I was able to do this and that. But you are more important than a job. And you should never, I'm sorry. We got this. You should never put anything like that in front of your health ever, because there's only one you. Like, literally, there's only one you. Unless you're a twin, then, but still, both of you are important. But there's only one you. And you have to make sure that you're important. Whether and that you take care of yourself, whether it's going to the doctor when people tell you you should go to the doctor, or just having a day of self-care, like sitting down and taking care of yourself. You are important and you matter. So make sure that you take care of you. Especially if other people around you are telling you, hey, something's wrong. Like, you need to see someone, whether it be physical, mental, make sure that you take care of you. And I just wanted to share that with you guys, okay? I love you. Thank you so much for tuning in, and you guys stay blessed.